cancer, we need to think about prevention.
Mhm.
And we don't think about that a lot, do we?
No.
And so we need not on, and when we say prevention, we don't mean that you're not going to get it, because some things really we don't have a rhyme or a reason for. But we talk about things that will be helpful for us in terms of perhaps not getting breast cancer or breast cancer reoccurrence. So I want to introduce you, and I just want to tell you to tell the audience a little bit about what you do. And this again, April, with you.
All right. So much for inviting me to talk about this because I'm really excited about this new venture. Um, and just to help everyone with my name is Woodyard. And
Woodyard.
yeah, just two words together. I used to be Liverman and now Woodyard.
And just when I was getting Liberman, she got married after 50 people.
Yeah, and now it's Woodyard. But so what I'm doing now is called manual lymphatic drainage, and like you said, it's a gentle type of massage to move the lymphatic fluid to the regional nodes, which help us get rid of toxins and cancers and bad cells, and also helps with circulation of our fluid. It supports our circulatory system. And the reason why I got interested in it, of course, is because I work in a breast care center, and patients that have surgery, especially if they have their lymph nodes removed, they are at an increased risk for lymphedema, which is where the lymphatic system is not functioning like it should, and the lymphatic fluid is not getting to those regional areas to get rid of the toxins. And so I like the manual lymphatic drainage and being able to do that as a therapist because it's a hands-on way for me to help my clients, which is so much of what I, love to do. With me helping people in the breast care center, I'm helping them with breast cancer prevention. Like you said, helping them recognize things that can help them not have a recurrence or recognize a recurrence. But now I'm also able to support them to help them with their immune system and getting rid of the toxins that they may be exposed to. So I'm excited that I'm able to venture out and do something that is also supporting preventative medicine.
Right. I think that is really great, because I think we need to move beyond just people getting the diagnosis and
Right.
then they go home. And some people, like in my case, my care was really great. I mean, I wish everyone could have that care, but everyone does not. And really having that knowledge that you don't have to go home and be by yourself,
Right.
that you can do other things to help. Especially now, could you explain how with lymphodermia, how the lymphatic flow will help that a little bit more?
Yeah. So lymphedema, basically, your lymphatic system, it's like a complex network, but it's pretty much the same as your circulatory system. So you have all these vessels that go throughout the body, and the circulatory system, we know it takes, the blood where it needs to go. And the lymphatic system supports the circulatory system. So the circulatory system actually will excuse me, release
Yeah.
some fluids in the capillary level that the lymphatic system picks up to take back to circulate to the lymph nodes to filter to get rid of the bad stuff before it returns it excuse me, to the circulatory system.
Hmm.
So we need the lymphatic system as part of our immune system. It helps to get rid of toxins, it helps to circulate proteins, it helps to get rid of excess fluid. So
Hmm.
the lymphatic system, the lymphatic massage can also help with blood pressure regulation. It can help with excessive fluid, like when people get edema. It is a great stress reliever. It gets rid of toxins, but all that movement of the lymphatic fluid will help our body to get rid of the bad things that we don't need and help to circulate the good things that we do need. So it works in conjunction with our circulatory system and definitely with our immune cells, our immune system.
Okay. Okay. So if I was, as like I said, one of the things for me is education. I thank God that I did have education about breast cancer prior to being diagnosed.
Right.
I had a lady that just yesterday at my church, she stopped me and said she had recently just been diagnosed with breast cancer, stage 2 or 3, and she said that she had a mammogram a year ago, but she felt the lump this time, and she said something that caught my attention. She said that the doctor said that it looks like it had been growing for about a year and a half. I didn't know that they could tell that, but that's what she said to me. And how would, at her point, at this stage, would lymphatic flow help her in what she's going through? She hasn't started chemo or anything, but she's going to be taking.
So it's not recommended in active treatment. So you should have it to finish the treatment. But the way it can help is that in some cases, some women will have lymph nodes removed when they're having breast cancer surgery. And that means that the amount of lymph nodes that person had or they were born with may be reduced because the doctor may remove some of those lymph nodes to check them to see if the cancer has spread. Because like I said, the lymphatic system goes all throughout your body. So the cancer cells can jump on that lymphatic system to get throughout the body, but your lymph nodes try to filter that. And in the case of cancer, of course, the lymph nodes become overwhelmed, and that's when we need other forms of treatment. But the benefit for a person that is undergoing or has undergone treatment for breast cancer is that we start to get the lymphatic system moving to get rid of any toxins that are left in the body or that they may be exposed to going forward, because their immune system may be compromised after treatment because they've been treated for breast cancer. But also if they suffer from lymphedema, which is when that limb or extremity where they had the lymph nodes removed starts to collect lymphatic fluid that it's not circulating well because you don't have as many lymph nodes in the axillary area. So that movement of the lymphatic fluid back to the axillary lymph nodes, or maybe other lymph nodes that are close by that can do the same job that the axillary lymph nodes did, the movement of that fluid helps, because you don't want that fluid to just sit in one area, and it will because of gravity. You know, your arms are down, your legs are down, you're moving that fluid, you're helping move that fluid up to an area where those toxins can be eliminated.
Right. And so I always tell people when they say, well, you know what, I'm sitting down, and when I get up, well, that's the point. You were sitting down. Because you were staying in that one place for so long, so now your joints have to start circulating again, have to start moving again, have to loosen up again. So it's kind of in that vein. So have you had any success stories with the treatment after breast cancer? I want to make it clear that it's suggested that it's treatment after. Well, you could tell me about the before without being diagnosed, and then after if you're diagnosed.
Being diagnosed with edema?
Or just not necessarily with I should clear that up. Just before, like a preventive type here. Yeah.
So I would say that the recent feedback that I got from one of my clients, and this particular client was really getting manual lymphatic drainage, not for post-cancer treatment, but basically for recurrent headaches. And for she wanted to detox her body. And so she said with the treatments that she had gotten, just after 2 treatments, she felt more energetic. She felt like her immune system was boosted. She had more energy, and she could really tell from prior to having the drainage done that she had more energy.
Right. And what's really great about that, it's not really like a medicine that you take.
Right.
because
Yeah.
people have a problem with
Right.
taking medicine. I'm one
Yeah.
of them.
Yeah.
but
Exactly.
but it's also something that is physical. It's a massage.
Right. And it's relaxing. It's a gentle flow. And what I do, some of the massage is done in a sound chair, which is a zero gravity chair that vibrates. And
Hmm.
playing calm music is vibrating. Vibration's good for the lymphatic system. I'm actually doing the gentle motions of the massage repetitively, and that kind of relaxes the person as well. So decreased stress, of course, decreases blood pressure, um, decreasing, anxiety. So,
Hmm.
and also doing a therapeutic thing that's moving the lymphatic fluid to the areas it needs to get to in order to get rid of the toxins. So it's really a therapeutic, relaxing type of therapy.
Okay, so if some of you all are watching and have any questions, we're talking about breast health and wellness, and wellness for me is the complete. It's
Yeah,
complete. It's all
right.
mind, body, and soul. Wellness for everyone. It's a balance. It's life balance,
Right.
and I think it's so important that we are educated. And I never start educating myself on breast care because it's affected my life, and of course I don't want a reoccurrence, but
Yeah.
it also can affect people that I know, and I just like to be knowledgeable. And so that's one of the reasons why I brought you on today, because I thought it was something that people should know, that we don't need to just wait on the breast cancer,
Yeah.
because some people who have a family history, I've read, and as a matter of fact, I know someone who said they were waiting on it because they knew it was going to happen to them because it was in their family. So
Yeah.
you don't have to sit there and wait. There's
Yeah.
some things that you could do.
Yeah. I also wanted to mention too, about back to breast density. I was doing a talk a couple of weeks ago, and I was talking to the audience about the lifetime risk calculation. And I was explaining to them that if your risk is above 20%, if you've never had breast cancer, how you needed to maybe talk to your, primary care doctor or breast care specialist about additional imaging. But the lifetime risk calculation gives them proof that you're in the higher category of risk. So
Hmm.
one of the things that they use is breast density to calculate your risk. And I was telling people it's important to go and have that done. And also, I had a patient last week who I was going to calculate her lifetime risk, and she mentioned that she had a breast biopsy. And I asked her, did she know the results of the breast biopsy? And she said she wasn't sure, but she had it done at our facility. So I went back to look in her records, and I discovered that she had a biopsy that had atypical hyperplasia, which is not cancer, but it can be a precancerous type finding.
Hmm.
And so that increased her risk significantly. But if you have a biopsy and you don't know the specifics of the pathology, you could be at high risk and not even know it. So just knowing about the biopsy results help
Hmm.
to do the calculation and let her know that, yes, now you are qualified for additional imaging as a high risk patient.
Hmm. And that is really great right there,
Right,
because I tell people, do you know your numbers?
right,
And when I say that, it doesn't mean like number. Sometimes it does, but it means like, do you know information about your body?
exactly.
If you are online on this Instagram, there is no reason why, unless your hospital, unless your medical facility does not have an online portal, there's no reason why you should not know the information about your body. And then when you look at it, in the case of myself, I don't always know what that means, but I'm able to either reach my medical professional for whatever it is, or I can look at the graph if it's blood test. So I'm an advocate of looking. So I don't know
Yeah,
how people could be online,
right.
and I did, and that's another thing. Actually, with when I posted on my feed, and recommend that people go back and look at that post. It was a great interview. I did have a poll, and 20% of the people said they were not aware of dense breasts.
Oh, wow. Oh, my goodness.
And it wasn't like this huge amount of people.
Yeah,
but it was enough that my question was, do you even know about that, or know about online portals? And people said no.
Yeah, because some people just get a letter that says their mammogram is fine, and they don't go into the portal to look at the actual report, which they should, because on some occasions they see things on the mammogram that they feel are benign, but they are findings. And so you want to know what your findings were, because
Right.
you mentioned about the doctor saying that patient's breast cancer had been growing for a while. So she might have had a report that said she had an asymmetrical density, but it looked benign. But as the years went on, that density started to get more dense and showed up. That's how they could tell that this probably started here and it advanced there. That's why skipping mammograms is not good, because if you know on your report you have an asymmetrical area, then you want to see on your report that asymmetrical area is not changing at all. And because it could progress to something that is cancer. So that's how sometimes we can tell that the patient might have had cancer 2-3 years ago, because we see the little asymmetrical area that continues to get more dense.
And so that's a good point, because when we're talking about preventive as well. So being able to look at that, and it's right at your hands, it's right there, it helps you. If this is my thing, if I don't understand what that word is,
yeah,
if they're saying, whatever they may say, and that I don't know what that means. So therefore, then I need to find out more what exactly. And it's okay, to ask. People can ask if you're not aware.
Yeah.
My mom did a blood test for Alzheimer's. That determines if you have Alzheimer's. And they sent the test back, and some of them were regular. The blood test came back as things I understood. Right. But when it was the actual Alzheimer's, I didn't know a thing on that. I'm like, and then when she went to her primary care doctor before we had our other meeting, she said, well, you know what, we're going to let the doctor, she said, because this is not making sense to me either.
Right.
So, they did break it down and everything, which she did not have Alzheimer's. But the point is that if you don't know, just ask.
Right. Absolutely ask. I mean, that part of my profession, being able to explain it in a very simple way where people can get it, and that happens a lot. Patients will come in with this preconceived sort of idea about breast screening, breast cancer prevention, but when I take the time to show them, I actually show them images, explain to them why a mammogram is important, why an MRI can be helpful, what the images look like when you get cancer on an ultrasound. Sometimes I'm a very visual person, so if I see things and statistics, I tell them numbers like 25% of patients will find their own breast lumps. And that will reinforce that you need to do some sort of self-breast exam at some point, like at least once a month. But those things, help people to understand, like I said, asymmetrical density. That may mean nothing to you, but if you saw some mammograms and I pointed out to you, okay, asymmetrical means that it's not symmetrical. Left and right side don't match. And I show them, then they're like, oh, okay, well, that makes sense. So it is important to ask questions, because sometimes the questions will relieve your anxiety. You'll be more educated. You'll know what to ask for with other providers. You'll know how to advocate for yourself when you understand more. So that's why I try to encourage patients and educate them as much as I can, so they know what to ask for when they go to the doctor.
Well, okay. I appreciate all that, and I am advocate of, health and fitness, and you wouldn't know about the 3 or 4 peanut butter cookies I ate yesterday, but I really, that's my 20%. Okay, I'm not perfect. Okay, but they're supposed to be plant based. I don't believe
Okay.
that. but here's what I want to do. I know that people are listening from all over, and but we're located here in Atlanta, and I'd like to, if you could give them your website, and I will put it in the feed as well.
I made this card too, so I'm gonna pull it up. It has the information on it about where I'm located. It also has that QR code that you can scan to schedule a visit or an appointment. The office that I'm doing the therapy out of is in Marietta, around from Marietta Square. I'm not far from Smyrna, not far from Atlanta. And also I have a special that I'm running for new clients, and it's 3 sessions for $120. It's like $40 per session, which is good for you to get a chance to experience, what manual lymphatic drainage is about, to see if it's something that you'd like to incorporate into your wellness program.
Great. That is great. Thank you for that. And here's the other thing. If you have any questions that you have, April, she's on IG, which we're on now, at our Caretakers Heart Street.
You can actually go to LumaFlow. I have I have a page for LumaFlow, and I'm going to put that page site on there for, although we're on Caretakers Heart Speaks, LumaFlow, if you're interested in manual lymphatic drainage, that's the what you need to search for on Instagram.
Okay. So 2 things. If you have questions, you could feel free to contact April on one of those, Caretakers Heart Speaks or LumaFlow LLC. The other thing that you also need to know is that she does do speaking, and I do workouts for exercises. So if you have needs for your organization or your business or just your groups, so please feel free to contact us, because that brings us joy. We do that.
Yeah.
April does not have to do it. She does what she does for a living, but she cares. So that's important, and that we do. So is there anything last minute that you would like to leave with us, April?
I would encourage everyone to have your screening, at least your breast exam or your imaging, done before the end of the year if you haven't done it this year.
Okay, that is point number 1. Don't be afraid, and I want to say to men, because I know I got a lot of men followers, but I want to say to you that make sure that you are aware too, because men have breast cancer.
They do.
But what I found a few years ago from men is that I did a fundraiser, and after the fundraiser, it was a music fundraiser. I was not diagnosed with breast cancer at that point, but I did a fundraiser, and the men came up to me afterwards and said they did not know. They weren't so concerned about themselves, but they were concerned about either their spouses that had it or their loved ones. And they said they really just didn't understand. They just didn't know. So take the time, men, to find out about these things too, because breast cancer patients need support.
They do.
And so I really want to encourage you to do that for the men who are watching.
Exactly. I agree. Yeah.
So at this point, we'll ask if anyone, I don't see any questions coming up, but if there are questions, we are available. And did you have anything else, April? I'm not sure.
No,
I heard you say.
I think that manual lymphatic drainage is good for fibromyalgia, which is when people have like pain and trigger points all over. It's good for, like I said, headaches, blood pressure regulation, getting rid of toxins, lymphedema, edema. And I also wanted to mention, I do have a client that I treat for lymphedema, and it's stage 4, and I encouraged her to use the other things that are recommended, like elevating your feet, and that's above your heart. Using dry brushing, which we didn't mention. Dry brushing is good for you to, something for you to do at home.
Hmm.
I also have those gloves that are somewhat abrasive that I use in the shower, and I basically dry brush my lymphatic fluid towards my axillary area with my arm raised in the shower. Those are things that you can do at home. Some people may need compression garments, which are elastic garments to
Hmm.
go over their limbs if they have lymphedema, or they may have a machine that actually does compression. So
Hmm.
those things are helpful too, depending on what your stage of lymphedema is.
Right, and I could test that when I opened up the dry brushes, what I used for my foot, and I thought I had neuropathy.
Oh,
Maybe I did, I don't know, but I've started using that dry brush on the foot,
good.
and it works. So I'm a believer, and that's another reason why I wanted you to come on, because it's part of the wellness. I am. And more better than I think I am, I think, and that's what I tell
You
people.
are
You are more better than you think you are. So
right.
thank you, April,
You're
and
welcome.
thank you
Thank
for the
you.
people that's joining, and God bless. And I will see you. I have one more set of exercise to do related to post-breast cancer
Okay.
range of motion, guys. So I'll be
Right.
doing that, and have a good day.
All right. Thank you so much.
Bye-bye.
Bye bye.